Bismillahirrahmanirrahim. We will start with quote of the day. It is difficult to be patient, but to waste the reward of patience is worse. This is by Hazrat Abu Bakr Siddiq radiallahu ta'ala anha. The topic of today's class is National and International Nutritional Program. I am Dr. Taimia Ayub. I will be presenting this topic today under the kind supervision of Professor Dr. Saira Afzal, Dean Institute of Public Health, Lahore. So these are the learning objectives of today's lecture. So we will start with why nutrition program exist and what is their significance in public health and economics. Preventable nutrition deficits drive child mortality, impaired neurodevelopment, maternal anemia, infection susceptibility, and many other reasons. And diet-related risk accelerate obesity, diabetes, cardiovascular disease. This is known as a double burden. Nutrition is a systems issue. Food, environment, plus care practices, plus wash practices, plus health services, plus poverty. And best outcomes come from packages delivered through multiple platforms, primary healthcare services, schools, markets, safety nets, etc. So, how to classify nutrition programs, also known as programs typology? So some of the programs are nutrition specific, direct. For example, for particular micronutrient, for prevention of community-based intervention for acute malnutrition and breastfeeding support program. And then some program are nutrition sensitive, indirectly. Social protection, agricultural, food system, wash, education, women's empowerment. And some programs are universal versus targeted. For example, fortification versus community-based intervention for acute malnutrition. Preventive versus therapeutic, for example, supplementation versus severe acute malnutrition treatment. Routine versus emergency, for example, primary care versus humanitarian response during in cases of emergency like floods and earthquake, etc. So across the life course, a person can need different form of nutrition packages. For example, during adolescent for anemia prevention, diet quality, and sexual and reproductive health integration. Then preconception and pregnancy, a person can need increased calcium, weight gain counseling, and antenatal integration. And when a child is born, then from 0 to 3 months, exclusive breastfeeding support, complementary feeding counseling, vitamin A, growth monitoring, timely referral, and so on. In under 5 children, immunization, integration, deworming were indicated, and CMAM for wasting. In school age children, school meals, snack, nutrition education, micronutrient, depending upon the context. And in adults, non-communicable diseases prevention, salt, sugar, trans fat reduction, healthy diet policy, and so on. So we will start with the national program. I have tried to include as much as I can, but some of the program I was able to find more information. So let's see. National programs and delivery platforms. In Pakistan, governance and delivery architecture is that after devolution of provinces lead implementation, federal sets standard coordination in many areas. Delivery platform commonly include, for example, primary health care through lady health workers, BHUs, RHCs, maternal and child health services, schools health or education system, food fortification and regulation, cash transfers, social protection, humanitarian nutrition during floods, displacements, etc. Nutrition and primary health care. Lady Health Worker Platform, which is working at national level. The typical functions for Lady Health Worker Program and nutrition programming include household counseling regarding breastfeeding and complementary feeding and maternal diet, screening MUAC referral pathways and follow-up, support for immunization, vitamin A days in many settings, community mobilization through linkages with facility services, and the key success factor for this program is mainly include training refresher training courses, supportive supervision, supplies, and referral compliance. So this is how Lady Health Worker platform is working in nutrition programs at national level. Then we have infant and young child feeding programs. Program elements um, include antenatal counseling plus immediate postpartum support, breastfeeding troubleshooting through information about latching, mastitis, perceived low milk, complementary feeding counseling about diet diversity, meal frequency, responsive feeding, community support groups, male or family engagement in the whole process, facility standards, for example, um, about policies in maternal setting and where they are implemented. Now we come to how World Food Program is working in Pakistan. According to World Food Program, this information is taken from its website. In Pakistan, 20.7% of the population is undernourished. 40% of the children under 5 are stunted. 240, the total population is 241 million. Pakistan continues to face a severe nutrition and hunger crisis, ranking 109th out of 127th countries in 2024 Global Hunger Index. The country is the eighth most climate vulnerable globally and has experienced unprecedented flooding with over 5 million people affected, more than 87 deaths reported. Multidimensional poverty remains high, with nearly 50% of the household monthly expenditure spent on food. 82% of the population unable to afford a healthy diet. And gender and social inequities significantly limit access to services. Women and girls face structural and cultural barriers to government services. Over 26 million children ages 5 to 16 are out of school. More than half of out of school children are girls. Child malnutrition remains alarmingly high. 18% of the children under 5 suffer from acute malnutrition. Approximately 40% of the children are stunted, reflecting chronic undernutrition. Record high food and fuel prices worsened by climate change impacts on agriculture. Infrastructure infrastructure have disproportionately affected poor and vulnerable households. World Food Program and response in Pakistan include collaboration with government and partners to improve food security and nutrition, emergency food assistance and early recovery support in flood-affected areas. Long-term WFP strategy focuses on stunting prevention, disaster risk reduction, strengthening food systems. So these are the main areas World Food Program is doing in Pakistan, providing nutrition, resilience building, sustainable food systems, and disaster preparedness and response. Now we come to Benazir Nashonuma program. So, Benazir Nashonuma program was launched in 2020, and its main objective is prevention of stunting and improvement of maternal and child nutrition. It is mainly being conducted by government of Pakistan, and it is being implemented under the Benazir Income Support Program. Technical and programmatic support is by World Food Program, World Health Organization, and UNICEF. And to date, they have covered more than 3.7 million women and children nationwide. The main target population are pregnant women, breastfeeding women, and children under 2 years of age. So, pragmatic focus is on the first 1,000 days of life from conception to 24 months. Nutrition sensitive conditional cash transfers, linkages with health and nutrition services. Strategic importance is that national flagship program for tackling malnutrition in Pakistan. It is the cornerstone intervention for stunting reduction. Key evidence is that 6.4% reduction in stunting among children under 2 years enrolled in Nashanoma program, 5.6% reduction in low birth weight in intervention districts, 20% lower prevalence of stunting at 6 months of age among beneficiary children, and more than 7 percentage point reduction in small and vulnerable newborn births, which all led to improved child survival outcomes, reduction in zero dose immunization prevalence. So these are some of the impact analysis which were done at midterm results from Aga Khan University, and how the Benazir Shanuma program has helped or prevented stunting. It has also improved in immunization status and so on. So now we come to scaling up nutrition and what are they doing in Pakistan. Pakistan is a Sun Movement country member committed to addressing malnutrition through a multi-sectoral approach. Sun supports coordination and alignment among government, UN agencies, donors, civil societies, academia, and the private sector. Focus areas include stunting and micronutrient deficiency reduction, integration of nutrition into health, food, social protection, and agricultural sectors. SUN promotes policy coherence and evidence-based action, nutrition financing and accountability, use of data for planning and monitoring. At provincial level, SUN principles guide integrated nutrition programming following devolution. Overall, SUN serves as a platform for progress. Okay, sorry. Uh, For this, let's continue. Overall, SUN serves as a platform for advocacy, coordination, and accountability to improve nutrition outcomes in Pakistan. Then we have Chief Minister's School Meal Program. Punjab government has publicly described a CM school meal program as a malnutrition focused pilot intended to improve health, learning, and attendance. It is targeting underserved district schools, and this is a pilot approach. Delivery modality is beverage, milk, snack model, logistics, and cold chain implications if milk based. Implementation needs include vendor contracting, quality testing, school level storage, dispensing SOP, etc. So it is basically targeting attendance and short term diet quality proxies, and preventing anemia and promoting growth of the children. So this is the flyer for the CM meal program, and this had been starting in South Punjab in the three districts, and these are some of the images from the program. So now we come to integrated reproductive, maternal, newborn, child health and nutrition (IRMNCH) and nutrition program of Punjab government. The government of Punjab initiative combining maternal and child health with nutrition for services, focusing on nutrition counseling for pregnant, lactating women and children, growth monitoring and referral services, integration with primary healthcare platform, used to deliver routine nutrition services at community and facility levels. Then we have Punjab Food Authority Nutrition Initiative, School Nutrition Program initiative by Punjab Food Authority. Phase 2 expansion of school nutrition efforts across Punjab provides healthy lunch boxes for school children, nutrition education, promotion of fruits, vegetable, and micronutrient rich foods. Activities include seminar and awareness campaigns in school to combat child malnutrition, nutrition awareness seminars and campaign. Punjab Food Authority conducts nutrition awareness seminars for students, parents, and teachers. Eat Safe Kids campaign promoting healthy dietary habits, supported by local food safety and nutrition messaging. Fortify Education Foundation. Fortify Education Foundation, non-profit, focuses on school meal program in underserved communities, provides free nutritious meal to students to reduce hunger and child malnutrition, improve school attendance and learning, works through partnerships with school and community stakeholders. And also, UNICEF is working in Pakistan to provide nutrition support. It works with federal and provincial governments to scale up micronutrient supplements and fortification, enhance breastfeeding and complementary feeding practices, strengthen health systems for the treatment of acute malnutrition. Supports integration of nutrition into broader health platforms, including early childhood development and sun movement frameworks. Then World Health Organization is working in Pakistan by providing technical supports for acute malnutrition treatment protocol, health system strengthening for nutrition services, and policy and guidance on nutrition best practices. This is some of the introduction of national programs and working for particularly for nutrition. Now we come to international organization working in the domain of nutrition. International nutrition architecture. Global nutrition is led through a multilateral system involving UN agencies, global alliances and partnerships, development banks, and donors. Focus areas include maternal, infant, child, and adolescent nutrition, food security and food systems, micronutrient deficiencies, nutrition and emergencies, and double burden of malnutrition. So first we come to World Health Organization. Its mandate is to global health leadership and normative guidance, sets global nutrition standards and guidelines, leads on infant and young child feeding, micronutrient supplementation, diet-related NCD prevention, obesity and unhealthy diet regulation, develops global nutrition targets, for example, for 2025, supports country and policy formulation, monitoring and evaluation. Its role is primarily normative and advisory and not food delivery. Then we have United Nations Children Fund, UNICEF, mended its child survival, growth, and development, focuses on maternal, infant, and child nutrition. Key interventions include IYCF counseling and breastfeeding support, community based management of acute malnutrition, micronutrient supplementation, nutrition in emergencies. Its strong presence is at community and primary healthcare level, works closely with governments to scale up delivery service delivery. Then we have World Food Program mended its food security and nutrition in humanitarian and development settings, provides emergency food assistance, school feeding and nutrition, school meal programs, targeted nutrition support, leads on nutrition sensitive social protection, food fortification, disaster preparedness and response, strong operational role in fragile and climate vulnerable contexts, and it bridges humanitarian and development nexus. Then we have Food and Agricultural Organization. Its mandate is food systems, agriculture and nutrition, focuses on food availability, access and utilization, dietary diversity and food quality, nutrition sensitive agriculture. It supports sustainable and climate resilient food systems, food safety and standards. Key role in addressing malnutrition through food system transformation. Then we have International Fund for Agricultural Development. Its mandate is rural development and poverty reduction, targets small holder farmers, rural women and young, nutrition impact through income generation, women empowerment, improved food access, strong role in nutrition sensitive livelihood, complements FAO and WFP within the UN food system. Then we have Scaling Up Nutrition Movement. Its mandate is global coordination and advocacy for nutrition. It is a country led multi stakeholder platform. It aligns with governments, UN agencies, donors, civil societies, academia, and private sectors. Focuses on policy coherence, financing for nutrition, accountability, and results. And as mentioned previously, Pakistan is also a Sun member country. Then we have Global Alliance for Improved Nutrition, GAIN. Its mandate is improved diet quality, especially for vulnerable population. It works on large-scale food fortification, market-based nutrition solution, private sector engagement, focuses on micronutrient deficiencies, affordable nutritious food, supports governments with technical assistance, regulatory systems. Then we have Nutrition International. Its mandate is eliminate vitamin and mineral deficiencies, specializes in vitamin A supplementation, iron and folic acid program, food fortification support. Strong emphasis on evidence-based intervention. it is very cost effective, and how to be more cost effective, works with governments to scale high impact nutrition micronutrient programs. Then we have the World Bank. Its mandate is financing and a policy reform for development, supports nutrition through health system strengthening, social protection, and cash transfers, childhood development. It emphasizes on nutrition as an economic investment, human capital development, and major financier of multi-sectoral nutrition programs. Then we have UNHCR, the UN Refugee Agency, nutrition and for nutrition in humanitarian settings. Its mandate is protection of refugees and displaced population, nutrition support for refugees and internally displaced persons, focuses on acute malnutrition treatment, infant feeding in emergencies, food assistance in camps and host communities, and works closely with World Food Programme and UNICEF in humanitarian contexts. So, this is a brief introduction of the national and international nutritional organizations and programs. So, now we come to multiple choice questions. A district health officer wants to reduce stunting by intervening during pregnancy and early infancy. Which programmatic focus is most appropriate? A. School feeding for adolescent. B. Treatment of SAM in children under 5 only. C. First 1,000 days of nutrition interventions. D. Food distribution during emergencies only. Or E. Adult NCD dietary counseling.
C.
Yes.
C.
Yes, first 1,000 days of nutrition intervention. A pregnant woman enrolled in a Benazim Income Support Program receives conditional cash transfers linked with healthy health visits and nutrition services. Which program is she most likely part of? CM School Meal Program, IRMNCH and Nutrition Program, Benazir Nashanuma Program, Punjab Food Authority School Nutrition Program, or WFP Emergency Relief Program.
C.
Yes,
C.
yes, it is Benazir Nashanuma Program. A policymaker wants an intervention that improves micronutrient intake without requiring behavioral change at household level. Which option is most suitable? IYCF counseling, CMAM, cash transfers, large scale food fortification, or nutrition education campaigns?
D.
Yes. So large scale food fortification can work without behavioral change at household level. During floods, children in relief camps are at high risk of wasting. Which combination of agencies is most appropriate for coordinated nutrition response during such disasters? WHO and FAO, UNICEF and WFP, IFAD and World Bank, Sun and GAIN, Punjab Food Authority, and NGOs only.
B.
Yes, it is UNICEF and World Food Programme. A public health team in Punjab integrates maternal nutrition counseling, growth monitoring, and referral through one platform. This approach best reflects parallel vertical programming, nutrition sensitive agriculture, integrated primary healthcare based nutrition delivery, emergency nutrition response, or private sector led nutrition model.
C.
Yes, so integrated primary healthcare based service. A child receives fortified wheat flour through a local chakki. This intervention primarily addresses which challenge in Pakistan? School absenteeism, acute malnutrition in emergencies, limited access to industrially milled foods, overnutrition in urban population, or poor breastfeeding practices.
C.
Yes,
E.
it is C, limited access to industrially milled. A provincial education department introduces a pilot providing daily nutritious pack in school located in underserved districts. The primary public health outcome expected is immediate reduction in maternal mortality, improved household food security, better attendance and learning outcome, reduction in adult NCD prevalence, or elimination of micronutrient deficiency nationwide.
C.
Yes.
C.
It is C, better attendance and learning outcome. This is the main idea behind the program. Which organization's core mandate is to set global nutrition guidelines rather than deliver food or supplements? WFP, UNICEF, WHO, FAO, or Nutrition International?
B.
Uh,
B.
so, so WHO's core mandate is to set guidelines for all the required global nutrition level and other guidelines also among others. So WHO is the one which is mostly focused on setting the standards and providing guidelines. A nutrition officer wants to align health, agricultural, social protection, and education sectors under one coordination platform. Which initiative best supports this goal? Hmm. CM School Meal Program, Benazir Income Support Program, Scaling Up Nutrition Movement, Community Based Management of Acute Malnutrition, or Punjab Food Authority campaigns.
C.
Yes, it is scaling up nutrition. A development planner is designing a program that links cash for work, construction of flood protection walls, and women's livelihood training. This approach mainly targets curative nutrition services, short term emergency feeding, resilience building to climate shocks, micronutrient deficiency control, or school health promotion.
C.
Yes, it is resilience building to climate shocks and so on. So this is the MCQ key, and this is the YouTube channel where this presentation will be uploaded. And thank you very much for listening.
Thank you very much, Dr. Taimia. Very nice presentation.